one of the most important drug discoveries in decades. That's what some scientists are calling GLP-1s. You've probably heard of Ozempic, Wegovy, Mounjaro, the GLP-1 receptor agonists. They've been on the news, they've been all over social media, and most of us probably know somebody who is actively using them. But behind the dramatic before and after photos, I think there's a really important conversation about health that we do need to have, especially since these drugs did start out for diabetes treatment, and it's looking like they're capable of helping in many more disease contexts than initially thought. This video is going to be part one of a two-part series. So in this first video, I'm going to explain how GLP-1 receptor agonists work, what they're usually used for, and the side effects and considerations that are involved. And no, I'm not just going to be talking about type 2 diabetes and weight loss. There is definitely more to it. I've got chapter links in the description, so feel free to skip any parts that you need to. In the second upcoming video, so that's part 2, I'm going to be discussing some of the ongoing research on GLP-1s, completely different diseases that these drugs are being studied for, and some of it will definitely surprise you. I'm talking addiction, neurodegenerative diseases, things that actually make a lot of sense in retrospect, but that are still pretty mind-blowing. So enjoy part 1 and stay tuned for part 2. Okay, so to understand GLP-1 drugs, you first need to learn about a hormone that your body already makes. It's actually called GLP-1, glucagon-like peptide 1. And certain regions of your intestines release it naturally every time you eat a meal. So think of it as a food has arrived signal that gets sent out to the rest of your body. Now, when that signal does get sent out, a few important things will happen all at once. Your pancreas releases insulin to handle the incoming sugar from your food. It also puts the brakes on a hormone called glucagon. Here's a quick way to think about it. Insulin and glucagon are opposites. Insulin lowers blood sugar. It's the use or store the sugar signal for cells. Once your cells have enough energy, insulin will signal your liver and your muscles to store any excess glucose as a complex sugar for later use. On the other hand, glucagon does the opposite. It raises blood sugar by getting cells that were storing sugar to release more into the bloodstream. And so after you've eaten a meal, the last thing that you need is your cells dumping more sugar into your bloodstream on top of what you just ate. So GLP-1 increases insulin and suppresses glucagon to keep things balanced. Meanwhile, your stomach slows down so that food moves through more gradually, and signals are sent to your brain saying, okay, you're good, you can stop eating now. That natural GLP-1 signal gets broken down within about 2 minutes of being released, so your body breaks it down really quickly. Scientists have figured out a way to make molecules that mimic this hormone, and these molecules last much longer. The active ingredient in Ozempic and Wegovy is semaglutide. So these are just brand names with slightly different formulations, but the same active ingredient. Semaglutide was engineered to have a half-life of 1 week, and a half-life is just the amount of time that it takes your body to cut the amount in your blood by half. And this is why, if you look at the dosing for those drugs specifically, the injections are weekly, not daily. And then there's tirzepatide, the active ingredient in brand name products Mounjaro and Zepbound, which mimics a second hormone called GIP on top of GLP-1. That makes it even more powerful. Drugs within this family do vary though. There are a few different kinds. Not all of them are weekly, some of them are daily. And that includes an oral pill form of semaglutide rather than an injectable. As you probably know, these medications were originally made for type 2 diabetes. They're really good within that indication. They do significantly cut blood sugar, and tirzepatide is particularly good at this. On top of that, because of the way that these medications work, you are then at much lower risk for a condition called hypoglycemia, which is when your blood sugar levels drop dangerously low, and then you end up being at risk of, for example, losing consciousness. That's because these medications are glucose dependent, and so they're only going to increase your insulin levels and decrease your glucagon levels when there's a lot of sugar in your blood. Once your blood sugar normalizes, the medicine is no longer active. Now, over time, we've discovered that there are many additional benefits offered by GLP-1s. Weight loss is a big one, and forget about aesthetics right now, I'm just talking about overall disease risk. Obesity increases your probability of developing a long list of other conditions. By acting on both brain and gut receptors, GLP-1s can help you to eat smaller and more satisfying meals and that encourages positive long-term habit changes. That action in the brain is super important. Many patients describe losing what they call food noise, that background hum in their thoughts about food, wanting snacks, that sort of thing. These drugs quiet that noise. People on these medications will typically lose between 15 and 25% of their total body weight over 1 to 2 years, and that depends on the dosage, of course, and the type of drug that they're taking. To put that into perspective, that amount of weight loss was previously only achievable through bariatric surgery, certainly not a pill or an injection. From here, we've got a bunch of additional benefits that come from both the weight loss, but also anti-inflammatory properties. First up, heart health. Multiple large clinical trials involving tens of thousands of patients have shown that GLP-1 medications can significantly reduce the risk of heart-related events. So that's heart attacks, strokes, and dying from heart disease. One major analysis confirmed a 14% reduction in these events. And in 2023, a landmark phase 3 trial called SELECT found a 20% reduction even in people without diabetes. So that's just people with obesity and existing heart disease. One important note here though, a 2026 study found that if you stop taking these drugs for 1 to 2 years, that heart protection goes away fairly quickly. Cardiovascular event risk climbs back up by around 14 to 22% respectively. So these aren't necessarily a short course of treatment by any means. These are meant to be taken longer term, just the same way as blood pressure medication. Speaking of which, these drugs consistently lower blood pressure by a few points through a combination of weight loss and direct effects on blood vessels. Kidney protection is another one. A major 2024 phase 3 trial called FLOW showed that semaglutide reduced the risk of kidney disease getting worse or leading to kidney failure by about 24% in people with diabetes and kidney disease. The trial was actually stopped early because the benefit was that clear. Next up, liver disease. In 2025, Health Canada specifically approved semaglutide for a very serious and rare liver condition called MASH. So that stands for metabolic dysfunction associated steatohepatitis, and that's liver damage that's caused by an accumulation of fat and inflammation. In the phase 3 trial, 63% of patients taking semaglutide saw their liver disease resolve, compared to just 34% on placebo. This is a big deal because effective treatments for this condition have been very limited to date. Now for an indication that gets us all particularly excited, cancer risk reduction. A large study published in the journal Annals of Oncology in 2026, analyzing 161,798 patients, found that people with obesity who took GLP-1 drugs had a 41% lower risk of developing obesity-related cancers compared to people who relied on diet and exercise alone. We're talking about cancers including colorectal cancer, breast cancer, thyroid cancer, and quite a few others that are known to be driven in part by excess body fat. Again, researchers believe the mechanisms include the weight loss itself, anti-inflammatory properties, but also potentially direct effects of GLP-1s on the cancer cells themselves. Important caveat though, doctors are not yet recommending GLP-1s as standalone cancer prevention tools. Okay, we've got a lot of association so far, but we're waiting for stronger evidence on this front. We're talking about really complex diseases here, and separating out those different variables can be very tricky. Last one, obesity-related sleep apnea. If you've ever been told that you stop breathing while you sleep, this one is for you to think about. A major 2024 phase 3 trial called SURMOUNT-OSA tested tirzepatide in people with obesity-related sleep apnea and found it significantly reduced the severity of their breathing episodes. And this was whether or not they were using a CPAP machine at the same time. Health Canada actually just approved Zepbound for this indication, and so for people who might struggle with CPAP therapy, this opens up a real alternative avenue. Now let's talk about the side effects and considerations, because every drug has them, so let's see what we're working with. GI problems tend to be very common, so we're talking nausea, vomiting, diarrhea, constipation, and stomach cramps. These affect a lot of people, especially during those first few weeks of treatments, and for some, those side effects will pass. For others, they'll persist, and so you do have people who will discontinue the medication because of those GI side effects. A doctor will typically start you out on a low dose and then increase your dosage gradually to try and get around this. All right, the next one is rare, but it's serious. It's called stomach paralysis. We mentioned earlier that this drug acts on your stomach and slows it down. So this can cause a rare side effect called gastroparesis, where your food will sit in your stomach for way too long. It's uncommon, but some of the symptoms include persistent vomiting, like to the point where you can't even keep any liquids down, feeling super full even if you've just had a few bites of food, severe upper abdominal bloating and distension, sharp abdominal pain, and intense acid reflux. Okay, the next three are considerations more than they are side effects because they can be preempted and planned for. These drugs carry a specific warning for people with a personal or family history of a rare type of thyroid cancer called medullary thyroid carcinoma or a related genetic condition called MEN2. If you do have that history, this drug is not for you. For everybody else though, large-scale studies in humans have found that there is no increased risk of thyroid cancer. Also, doctors are careful about prescribing these drugs to anybody with a history of pancreatitis. Large clinical trials have not yet confirmed a significant increased risk, but doctors are just operating out of an abundance of caution. Next one is surgeries. I'm sure you've heard about this one. If you have a surgery coming up, your team absolutely needs to know that you are on GLP-1s. Why? Well, because the drug slows down the movement of your stomach. While people have been under general anesthesia, we've heard stories about the food coming back up on them, so the food's being regurgitated. And as you can probably imagine, while you're unconscious, that can be very dangerous. It can cause breathing problems. You could then inhale the food that you've just regurgitated. That's called pulmonary aspiration. So your team absolutely needs to know whether or not you're on GLP-1s if you're about to go into surgery. Now, importantly, when you rapidly lose weight, using any method, some of the mass that you're losing is not just fat. Some of that is muscle, some of it is bone. Again, this is common to any rapid weight loss method. It's not just unique to GLP-1s. However, this can be a real concern, especially for elderly patients. As we get older, we're already losing muscle mass. We're already losing bone density. The good news is the research is clear. Getting enough protein and regular strength training can help to protect your muscles and your bones while you're on this medication. Another critical point here is that once patients stop taking this medication, typically they're going to regain that weight that they've just lost back. For many people, that means that this medication ends up being a lifelong commitment. Again, we're going to take it back to that example of blood pressure medication. It's going to work as long as you're taking it. On the other hand, there is a world in which taking this medication makes you feel better about yourself, helps you move in ways that maybe you couldn't move before. And so in that way, it encourages a better lifestyle. Maybe you're now confident enough to go swimming. You can wear a swimsuit without feeling bad, that sort of thing. So for some people, they might be able to keep a proportion of that weight off once they stop this medication, but only because they've made the appropriate lifestyle changes throughout that period. Just something to keep in mind, it does not apply to everyone. One real world barrier that is definitely worth mentioning is that these medications can cost a lot if you don't have insurance. Studies show that almost half of patients will stop taking these medications within the first year, and a big part of that is because of the cost. Access is a serious equity issue that we need to keep talking about. There are actually discounts and saving cards that I know of for Ozempic. Link is in the description. So it seems like this is an issue that's being worked on to some extent. On top of that, a generic form was just approved by Health Canada, so that should be much cheaper as well. At the end of the day, if you only take one thing from this entire video, let it be this. These drugs work best as part of a bigger picture, one that still includes eating well, staying active, and following advice from a healthcare provider that knows your full history. They will help you make all of the decisions that you need to make. So the most important part of this is looping your doctor in. Don't just try to DIY it by ordering it from some shady website, okay? You don't know what you're getting. You don't know what's in that pill or in that liquid that you're injecting into your body. That could hurt you. It could make you sick. Let your doctor help you get it from a reputable pharmacy and let them determine your dosing. Let them supervise your outcomes. They'll also help you to determine if you should be taking these drugs in the first place, because they are not for everyone. Stay tuned for part 2. I'll be talking about all of the active, ongoing research involving GLP-1s, again, covering indications that are super unexpected, but in retrospect, make a lot of sense. Neurodegenerative diseases, addiction, very promising stuff. And in the meantime, if you learned something, share this video with a friend.